Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Ashraf. May I know what brings you here today? Okay, tell me more. I'm really sorry to hear about that, Mrs. Ashraf, and I understand that how stressful situation would be for you. So, Mrs. Ashraf, would you like to add anything more? All right, Mrs. Ashraf, before I come to the management part, I need to ask you a few questions, okay? And some of questions will be of some private and personal nature, okay? But let me reassure you that the whole conversation will remain confidential between you and me, if it makes sense to you, Mrs. Ashraf. All right, Mrs. Ashraf. So, you have heavy flow and pause clots as well? Okay, and can you tell me your periods are regular? Okay, and may I know how long do your periods last? Okay, and for 3 to 4 days. Okay, are they painful as well? Okay, okay, and since how long you are suffering from heavy periods? Okay, is there any intermenstrual bleeding as well? Okay. Right, Mrs. Ashraf, do you have children? Okay. All right, mashallah. Okay, so Mrs. Ashraf, what was a mode of delivery? Okay, all right, Mrs. Ashraf, so is there any postcoital bleeding as well? Okay, if you are using any contraception like IUCD? Okay, all right, and then if you are using any combined oral contraceptive pill, okay, have you stopped taking COCP pills? All right, Mrs. Ashraf, what about your PEP cervical smear, if it is up to date and normal? Okay, and are you using any anticoagulation medicine like aspirin? Okay, all right, Mrs. Ashraf, if there is any stress these days, all right, if you become short of breath, have you noticed any fever? Okay, any weight gain or weight loss? Notice any change in your voice? All right, Mrs. Ashraf, is there any diagnosed pelvic inflammatory disease like endometriosis? Okay. Okay, all right. Did you ever have treatment of excessive bleeding in past? Okay, any surgical history? All right. Okay, Mrs. Ashraf, so have you ever been to gynecologist for this problem? No? Okay. May I know if there is a high blood pressure, high blood sugar? Okay, if any history of trauma? Okay, doing heavy exercise. Okay. Okay, Mrs. Ashraf, so may I know how this problem has affected your life? Okay. All right. Okay, Mrs. Ashraf, I understand your worries, and I'm really sorry to hear about that. But you need not to be worried, Mrs. Ashraf. I'll try best of my abilities to solve your problem, if it makes sense to you, Mrs. Ashraf. Yes, Mrs. Ashraf. Okay, and is there anything else you are worried about specifically? Okay. No, Mrs. Ashraf, I'm here and I'll explain everything to you, okay? You need not to be worried, all right? Yes, Mrs. Ashraf. In order to reach my diagnosis, I need to examine you. Is it okay with you? Thanks for your cooperation, Mrs. Ashraf. Can you please come to the couch? Then I'll start from looking at the patient's face and if it is pale or not, and then I'll start from hands. I'll check the palms if they are moist, if there is any palmar erythema, and if there is any tremors and shaking. And then I'll check nails if there is any koilonchia, spoon shape or clubbing or any hemorrhages, and then I'll check pulse of patient, and then I'll ask patient to Mrs. Ashraf, can you please look up, look down, and show me your tongue. Okay, I'll examine your neck from front. Okay. Okay, and from back. Okay, please swallow. Okay, and then Mrs. Ashraf, can you please lie down on the couch, and I'll examine your abdomen. Okay. Okay, Mrs. Ashraf, thank you. And then I'll first inspect if there is any scar, any deformity, any bulging, any asymmetry, and then I'll start palpating gently and then deeply for organomegaly, and if there is any mass and then uterus. And then I'll auscultate heart at aortic, pulmonary, tricuspid, and mitral valve. And then at the end, I'll check for if there is any pedal edema actions. Thanks for your cooperation, Mrs. Ashraf. And at the start of examination and at the end of examination, I'll sanitize my hands and let them dry. Thanks for your cooperation, Mrs. Ashraf. You can have your seat. So, Mrs. Ashraf, in order to confirm my diagnosis, I need to perform certain tests. How it sounds to you? Yes, Mrs. Ashraf, it's full blood count, okay, and thyroid function test, and coagulation screening test, okay, and ultrasound abdomen and pelvis, okay. But before I, perform these tests, let me confirm it from you that if you have ever gone under investigation so far. All right, Mrs. Ashraf, may I know results of test if done already? Okay, Mrs. Ashraf, 32 years. Okay, then I'll keep all labs in front of me, and I'll give back, hand over back at the end of consultation. Right, Mrs. Ashraf, also from the information you have shared with me and from examination and investigation findings, most probably cause of your painful excessive bleeding or multiple fibroids, okay? And do you know what are fibroids? Okay, Mrs. Ashraf, you need not to be worried. I'm here to explain it to you, okay? Actually, fibroids are simple non-malignant muscle tumors of your uterus. Okay, and fibroids not only cause excessive bleeding and pain, but also make pregnancy to occur difficult. But you are, lucky, mashallah. Okay, but Mrs. Ashraf, if pregnancy has occurred and fibroids is near the opening of the womb, they can cause some difficulty in delivery and severe bleeding as well. Okay. But not in your case, okay. I'm just telling you in general, okay. So, Mrs. Ashraf, for symptomatic relief, okay, I'll offer you mefenamic acid, okay, mefenamic acid and tablet 500 mg, okay. You have to take it thrice a day, okay, on the start of day 1 and continue for days of heavy flow, okay. And it will not only decrease the bleeding cycle, but also pain during the periods, okay? If it makes sense to you, Mrs. Ashraf. Yes, Mrs. Ashraf. And besides that, I'm also offering a capsule tranexamic acid, okay? You have to take one capsule thrice a day, okay? It will reduce bleeding, okay? And tranexamic acid 1.5 gram, okay? And some drugs like ulipristal acetate can be used to shrink the fibroid size, okay? And there are some hormonal treatment as well in the form of IUS and may be effective in reducing menstrual bleeding, okay? But for definitive treatment, I'll offer transvaginal removal of fibroids, okay? A procedure called hysteroscopic resection of fibroid, okay? Also called myomectomy. But for that reason, I'll refer you to gynecologist, okay? If it makes sense to you, Mrs. Ashraf. Yes, Mrs. Ashraf, these are only for, if your problem not resolved, okay, then I'll be referring you, okay. And let me tell you safety netting, Mrs. Ashraf. If you experience any excessive bleeding, please seek immediate medical help, okay. And if you become short of breath, okay, you may need to be referred to the gynecology department, okay. Is everything clear till now, Mrs. Ashraf? All right, Mrs. Ashraf, here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Okay, and I'll hope to see you next month. Okay, is it convenient for you, Mrs. Ashraf? Okay, Mrs. Ashraf, I wish you a healthy life. Take good care of yourself. Bye-bye.